Hey, it's the Dr. White, and once again, I'm here at the Dr. Whiteboard to talk to you about dry eye. Dry eye is incredibly common. We see it at Sky Vision every single day. There are certain groups of people that get it more frequently than other groups. The classic dry eye patient is a woman between the ages of 35 and 55 who's having some problems that she never had before, and it seems to be that women get it earlier in life, have more problems, and get it more frequently than men. Now, it's not only women, but that seems to be where we see it most. So what happens? What kind of things does dry eye do? Well, here are some of the symptoms. Classically, people who have dryness will come in with some symptoms like this. What do you think the most common thing, the most common complaint people have when they have dry eye? Think about it, I'll wait. My eyes are dry. That one's pretty easy. We always know what the problem is when someone comes in and says, hey, Dr. White, my eyes are dry. But sometimes the symptoms are a little bit more subtle. Pain. Some people come in and say, man, my eyes just hurt all the time. Redness. Dry eye is actually the most common cause of redness. I probably see at least 36 people who have redness caused by dry eye for every single person who has allergy. Allergy is actually really not as common as dry eye by a factor of probably 30. Tearing. This one's kind of weird. People with dryness actually tear. They come in and sometimes they literally have tears coming down their face. I've had women come in with the Alice Cooper look where their tears are coming down with their mascara. It doesn't work. It never works for anybody. It doesn't even work for Alice. But tearing actually is one of the major symptoms from dryness. And I'll talk a little bit more in depth about why the tearing is a symptom later on. That's not Facebook. I love Facebook. I'm a huge Facebook fan, but that actually stands for foreign body sensation. Sometimes it feels like you have something in your eye. You can get a little tiny dry spot on the front of your eye, and every time your eyelid goes over it, instead of smoothly traveling, it catches. And that makes it feel like there's something in there. Fatigue is classic. You know, Doc, every night when I'm sitting down, if I'm reading, I'm doing homework, I'm looking at my computer, I just poop out. I don't have any lasting. I get tired. Blurred vision. Remember when we talked about what the tears are and how they work? We talked about that tear film sitting on front on the surface of the window to the eye, the cornea. Well, the first thing light actually hits is not the cornea. It's the tear film that sits in front of the cornea. So if your tear film's not working very well, you can get blurred vision. Some people come in and say it feels like their eyes are burning. This classically happens in a type of dryness called evaporative dry eye, where your tears evaporate too quickly, and over the course of the day, your eye just doesn't get lubricated well enough. A lot of times this happens with people who use computers, and we'll talk some about that later on too. And another one is contact lens intolerance. Someone will come in and say, you know something, Dr. White, I've worn contact lenses for 20 years and all of a sudden I just can't wear them. They feel lousy. I put them in and 30 minutes later I just want to rip my eyeballs out. Ripping your eyeballs out is not recommended daily practice. You'll never hear an eye doctor suggest that. However, a lot of times the contact lens intolerance is caused by dryness. Now there are lots of other symptoms that can be caused by dry eye, but I wanted to give you an introduction with some of the examples of things that you might not think about when dryness is actually the problem. Now we'll come back and we'll touch on some of these individually, and more importantly we'll talk about why it is that you get these symptoms, and then how can we fix it. So I'm the Dr. White, we're here at the Dr. Whiteboard, and we'll be there again.